As a doctor, I see it every single day. A patient sits across from me, we have what feels like a great chat. We map out a plan together and they walk out of my office. And I know with an almost mathematical certainty that by the time they get to their car, they've already forgotten up to 80% of what we just discussed. This isn't a guess. It's a well-researched medical phenomenon. Studies consistently show that 40 to 80% of medical information is forgotten the second a consultation is over. And to make it even scarier, of the little information patients do hold on to, almost half of it is wrong. Just let that sink in. You could leave your doctor's office with what amounts to a coin flip's chance of misremembering critical advice about your health. This isn't a small problem, it can be dangerous. It leads to people taking medications the wrong way, not following through with treatment plans, and a whole chain of complications that could have been prevented. The reasons are pretty clear. The clinic is a stressful place. You're usually feeling sick or worried, and let's be honest, we doctors have a bad habit of slipping into complicated medical jargon. It's the perfect storm for brain fog. But here's the most important thing I'm going to say today. This is not your fault. It's not a reflection of your intelligence or a sign you weren't listening. It's just how our brains work under pressure. The good news? You have the power to completely flip this script. You don't have to be a passive observer in your own healthcare. Over my years in practice, I've seen what the most empowered and successful patients do, and I've broken it down into 5 non-negotiable moves. These aren't just little tips. They are proven strategies that will turn your doctor's visits from a source of stress into a moment of clarity. In this video, I'm going to walk you through the 5 things you must do to take back control and actually remember the advice you're given. Let's start with the one that's the biggest game changer of all. Section 1. You must record the conversation. If you only do one thing on this list, make it this one. The most powerful tool you have to fight forgetfulness is probably in your pocket right now, your smartphone. I want you to start audio recording your appointments. I get it, that might feel weird, maybe even a little confrontational. For a long time, doctors were nervous about this, mostly because they were afraid of being sued. But that culture is changing fast, and for good reason. The benefits for you are just too huge to ignore. Research shows again and again that having a recording of your visit makes a massive difference in how much you remember and understand. It turns a stressful, fleeting conversation into a permanent resource you can revisit anytime. Let's be clear about the goal here. This isn't about trying to catch your doctor in a mistake. It's about building your own personal medical library. A recording captures every detail and every instruction exactly as it was said. You can listen back later in the comfort of your home without the pressure of the exam room. This simple action can be the difference between remembering to take a pill twice a day with food and misremembering to take it once a day on an empty stomach, a tiny memory slip with potentially huge consequences. So, how do you do this without making it awkward? First, just ask. At the start of the visit, say something simple and polite like, "Doc, I find it really helpful to review our talks later so I don't miss anything. Would you mind if I made a quick audio recording for my personal use?" When it's framed as a tool to help you follow through, most doctors are totally fine with it. In fact, many, like me, now actively encourage it. It means better patients, fewer frantic follow-up calls, and better health outcomes. Second, keep it simple. You don't need fancy gear. Your smartphone's voice memo app is perfect. Before the appointment, find the app, do a test run so you're not fumbling with it, and make sure your phone is charged. When the visit starts, just hit record and set your phone down. Finally, actually use the recording. Sounds obvious, right? But it's the most important part. Later that day, listen back to the whole chat. You will be shocked at what you missed. You can pause, rewind, and take notes. If a medical term was confusing, you can hear it again and Google it. If the instructions were complex, you can listen as many times as you need to. It's your personal study guide, and it will empower you like nothing else. Section 2. You must take notes and use the teach-back method. Recording the visit is your safety net, but to really burn information into your brain, you need to engage with it during the appointment. This is where the 1-2 punch of taking notes and using the teach-back method comes in. This isn't about writing down every single word. It's about forcing your brain to process what you're hearing in real time. Let's start with notes. The physical act of writing things down is a proven memory booster. It flips a switch in your brain, turning you from a passive listener into an active participant. So, bring a notebook and pen, or use a notes app. Don't try to be a court reporter. That's what the recording is for. Instead, capture the big picture items in your own words. Now, here's the magic trick. You use the teach back method. Teach back is an evidence-based tool that is incredibly effective at improving patient understanding and safety. It's so simple, but it feels like a superpower the first time you use it. Teach back does two amazing things. First, it instantly flags any misunderstandings. If you got the dosage wrong, the doctor can correct you on the spot. Second, by saying the plan out loud in your own words, you are kicking that info from your shaky short-term memory into your more stable long-term memory. Hearing it, writing it, and saying it back, it's a trifecta for making memories stick. Section 3. You must prepare a prioritized agenda. Think about it. You wouldn't walk into a huge meeting at work without an agenda, would you? Of course not. A doctor's appointment is a critical meeting for the most important company in the world, you. It deserves the same preparation. Winging it is one of the biggest mistakes you can make. The clock is ticking, information is flying, and it's way too easy to get sidetracked and leave without asking that one burning question you had. This is why you need a prioritized agenda. Here's the plan. A day or two before your visit, sit down and just brain dump all your questions, symptoms, and concerns into a notebook. Don't filter, just write. New pain? A weird side effect? Need a refill? A form for your gym? Get it all on paper. Next, and this is the crucial part, you have to prioritize. Let's be real, you've probably only got about 15 minutes. Identify your top 2 or 3 must-discuss items. If you come in with a laundry list of 10 things and start with the least important, you might run out of time before you get to the chest pain that's been scaring you for weeks. As a doctor, it is a huge help when a patient kicks things off by saying, "Thanks for seeing me. I have a few things to cover, but the most important thing for me today is this new pain in my shoulder." That tells me exactly where our focus needs to be. Doing this shows your doctor you're an organized, engaged partner. It guarantees your biggest needs are met and makes the whole visit more efficient. You'll leave feeling heard and in control because you were in the driver's seat from the start. Section 4. You must request a written summary. Even with your recording, your notes, and your teach back, getting an official document from the clinic that recaps the visit is the final piece of the puzzle. This is your official cheat sheet, and you shouldn't leave without it. Most clinics with electronic health records can print out an after-visit summary. This thing is a goldmine. It usually includes your vitals from the visit, such as your blood pressure, an updated list of your meds, including any new ones, the official diagnosis for the visit, orders for labs or imaging, follow-up instructions. This document is your immediate fact-checker. When you get home and everything feels like a blur, you can look at the AVS and see the name of that new medication in plain black and white. No more guessing. Here's the thing, you might have to ask for it. While it's becoming standard, a busy front desk might forget to print it. As you check out, just ask, "Could I get a printed copy of my after-visit summary?" It's your health info. You have a right to it. Even better, this summary is often posted to your online patient portal. If you haven't signed up for your clinic's portal, do it now. Patient portal use has surged, with access increasing by 50% between 2020 and 2022 alone. There, you can see your AVS, check lab results the moment they're ready, and even send secure messages to your doctor's office. This official record closes the loop. The recording has the context, your notes have your understanding, and the AVS has the non-debatable facts. With all three, the odds of misremembering something important plummet to almost zero. Section 5. You must bring a second set of ears. Going to the doctor, especially when you're sick, worried, or getting serious news, is overwhelming. In those moments, your brain's ability to process information tanks because of stress. That's why the fifth and final rule is to bring a trusted friend, family member, or caregiver to your appointments whenever you can. Think of this person as your co-pilot. Their job isn't to speak for you, but to be a second set of ears listening from a less emotional place. While you're busy describing what's wrong and trying to absorb the doctor's words, they can catch the details that might slip past. A support person is a game changer in a few ways. First, they're just good for your nerves. Having someone you trust in the room can lower your anxiety, which literally helps you think more clearly. Second, they can be the designated note taker. They might hear a specific instruction you missed or catch the name of a referral while you were thinking about your next question. Afterward, you can compare notes and build a much clearer picture of the visit together. Third, they can help you stick to your agenda. Before you go in, show them your list of questions. If you get flustered and forget one, they can gently jump in. Hey, we were also going to ask about the side effects of that new medication. They can also ask for clarification on something you both found confusing. Sometimes, a question asked in a slightly different way is all it takes to get a clearer answer. This is absolutely critical for big appointments, getting a new diagnosis, a pre-op consult, or going over complex test results. When the stakes are high, your brain is maxed out. Having an advocate ensures a clear head is in the room to absorb the details and make sure you both understand the plan. Choose someone who is a good listener, calm under pressure, and who you know has your back. Their presence is one of the kindest and most effective things you can do for your own health. So, there you have it. The 5 non-negotiable actions to take complete control of your doctor's visits. Let's recap one last time. 1. Record the conversation, your personal replay button. 2. Take notes and teach it back. Write it, say it, and make it stick. 3. Prepare an agenda. Go in with a plan and lead the meeting. 4. Get a written summary, your official factual cheat sheet. 5. Bring a second set of ears, your trusted co-pilot and backup memory. I know it might feel like homework, but I promise these strategies will fundamentally change your relationship with your health. You'll go from being a passenger to being the pilot of your healthcare journey. You'll leave every appointment with a clear, actionable plan and the confidence that you know exactly what to do next. The days of forgetting 80% of what your doctor said are over. You're building a system for safety and clarity that will pay dividends for the rest of your life. If you found this helpful, please like this video and subscribe for more evidence-based health advice. And now, I want to hear from you. Which of these tricks are you going to try at your next appointment? Do you have another tip that works wonders for you? Share it in the comments below. Your experience could be the thing that helps someone else in this community. Thanks for watching.